Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome to new course, Gastrointestinal Tract 1. I will teach the anatomy part with Dr. Amani Al-Faqi, inshallah. Good luck. Pharynx. What is the pharynx? Pharynx is a fibromuscular tube about 12 centimeters in length. This tube extends from the base of the skull to 6 cervical vertebrae, opposite to the cricoid cartilage of the larynx anteriorly. So, this is the pharynx. Fibromuscular tube extends from the base of the skull to the 6 cervical vertebrae. This tube located posterior to the nasal cavity, oral cavity, and larynx, so it can be divided into 3 parts according to their location. Nasopharynx located posterior to the nasal cavity. Oropharynx located posterior to the oral cavity. Laryngopharynx located posterior to the larynx. Nasopharynx. As general, the pharynx is a pathway for digestive and respiratory tract. Nasopharynx is a part of the pharynx has only oropharynx is a share between respiratory and digestive tract. Okay, this nasopharynx extends from the base of the skull to the upper surface of the soft palate. This area. The nasal cavity communicate with the nasopharynx through posterior nasal aperture or choana. This opening, known as posterior nasal aperture or choana, and communicate the nasal cavity with nasopharynx. There are many features in the nasopharynx, such as pharyngeotympanic tube or auditory tube or Eustachian tube. This pharyngeotympanic tube, from their name, connects the pharynx with the tympanic cavity. Tympanic cavity means middle ear. This tube responsible for equalize the air in the middle cavity. So this is the pharyngeal opening of auditory tube. As you see here, this tube surrounds superiorly and posteriorly by elevation known as tubal tonsil. Tubal tonsil formed by aggregation of lymphoid tissue. So the lymphoid tissue here collected to form tubal tonsil. Also, there are aggregation of lymphoid tissue in the roof and posterior wall of the nasal cavity, known as pharyngeal tonsil. So, aggregation of lymphoid tissue in the nasopharynx are tubal tonsil and pharyngeal tonsil. This pharyngeal tonsil degenerate at the age between 6 to 7 years. And also known as odenoid tonsil. It is more common to inflamed in the children. Okay, this pharyngeal tonsil also known as third tonsil. Okay, posterior to the Eustachian tube or pharyngeal auditory tube, there is another elevation formed by salpingopharyngeal fold. This salpingopharyngeal fold formed by underlying muscle. So there is a muscle here known as salpingopharyngeal muscle. This muscle form elevation known as salpingopharyngeal fold. Posterior to this fold there is a recess known as pharyngeal recess. So these are featured in the nasal cavity, which are pharyngeal tonsil, tubal tonsil, salpingopharyngeal fold, pharyngeal recess, and pharyngeal opening of pharyngeotympanic tube. Okay. Oropharynx. Oropharynx is a part of the pharynx located posterior to the oral cavity. It extends from the upper surface of the soft palate to the upper border of epiglottis. Epiglottis is a part of larynx. This oropharynx extends from the upper surface of the epiglottis, from the upper surface of the soft palate to the upper border of epiglottis. The anterior boundary formed by the base of the tongue. On each side there are two folds known as platoglossal fold and platopharyngeal fold. Between them located the palatine tonsil. Superiorly located the soft palate. Posteriorly located the posterior surface of the pharynx. The main feature here are platoglossal fold, platopharyngeal fold, palatine tonsil, and lingual tonsil. So also here are aggregation of lymphoid tissue, palatine tonsil and lingual tonsil. Okay. Palatine tonsil is a collection of lymphoid tissue located between two folds, which are platoglossal and platopharyngeal fold, and rest on the tonsillar bed, which is formed by superior constrictor muscle, described later with the muscle of the pharynx. The palatine tonsil supplied by branch of the facial artery known as tonsillar artery and drain into pharyngeal plexus. This is palatine tonsil located between two arches, platoglossal and platopharyngeal arch or fold. Okay, laryngopharynx. This laryngopharynx extends from the upper border of epiglottis to the lower border of cricoid cartilage. The posterior and lateral wall formed by constrictor muscle. The main feature is piriform recess. This is piriform recess. This piriform recess has very clinical importance. The fish skeleton or foreign body can be located here and lead to damage of recurrent laryngeal nerve and or an internal laryngeal nerve. This nerve located here. When the fish skeleton or foreign body located here may lead to injury to the recurrent laryngeal nerve or internal laryngeal nerve. Okay, we define the pharynx as fibromuscular tube, so it is formed by muscles. This muscle divided into two groups: longitudinal muscle and constrictor muscle. The constrictor muscle are three in number: superior constrictor, middle constrictor, and inferior constrictor. The longitudinal muscle are three: stylopharyngeus, platopharyngeus, and salpingopharyngeus muscle. These are constrictor muscle: superior, middle, and inferior. The superior constrictor muscle originates from the skull here, from the cricoid humulus. The middle constrictor and also from the mandible. The middle constrictor originates from the cricoid cartilage. The inferior constrictor originates from the oblique line of thyroid cartilage and from the side of cricoid cartilage. This muscle inserted here in membrane known as pharyngeal raphe. The longitudinal muscle located internally and known as this one salpingopharyngeal muscle. Salpingopharyngeal muscle originates from the auditory tube and inserted in the side of the pharynx. This muscle responsible for opening of the auditory tube after swallowing. And also we have platopharyngeus. Platopharyngeus originates from the soft palate and inserted into the side of the pharynx. This muscle elevates the pharynx after swallowing. The last one is stylopharyngeus. Stylopharyngeus originates from skull. In the skull, there is a spine known as styloid process. So it originates from styloid process and inserted in the side of the pharynx. Also elevates the pharynx. Okay. So again, the muscle of the pharynx divided into 3 constrictor and 3 longitudinal. The 3 constrictor are superior, middle, and inferior. The 3 longitudinal muscle are salpingopharyngeus muscle, platopharyngeus muscle, and stylopharyngeus muscle. Nerve of the pharynx. The nerves form plexus. These plexus contain motor and sensory. Motor for muscle. So all the muscle of the pharynx supplied by vagus nerve except stylopharyngeus muscle, which is supplied by glossopharyngeal nerve. The sensation from the pharynx carried by glossopharyngeal nerve. Blood supply of the pharynx from the ascending pharyngeal artery, ascending palatine artery, lingual artery, tonsillar artery, and superior and inferior laryngeal arteries. The venous train form plexus known as pharyngeal venous plexus. This pharyngeal venous plexus may terminate into internal jugular vein or pterygoid plexus. Okay, that is all.